Nursing home workers picketed this afternoon outside dozens of facilities across the state, including several here in the mid-state.
Seth Kaplan is live with what they're demanding and who they're demanding it from. Seth.
Yeah, Valerie and Alicia, and that second part, who they're demanding it from, is the interesting part about this picket. Usually when you see folks chanting and holding signs like these folks, you know who's on the other side. Well, this one's a little more complicated.
We're not in a position anymore to let people be on side.
Which might sound strange when you look at a picket line like this one in Cumberland County, one of dozens like it at nursing homes across the state. You might think when you hear that and see workers holding signs outside, the object of their anger would be the folks inside running the place. Not so, says certified nursing assistant Liz Wright.
It's not us against them, management against, the union. It's not.
That's what she says, what Matthew Yarnell, who runs the SEIU Healthcare PA union, says, and also what Zach Schamberg of the Pennsylvania Healthcare Association, which represents the facilities, says.
It's not about providers and workers being at odds.
What it is about, according to, once again, all of them.
My daughter went to McDonald's making $16. I've been doing this job for over 25 years, and she's making almost just as much as I am.
Years ago, long-term care competed with hospitals and other healthcare services. Today, we're competing with Sheetz and Walmart and Wawa.
And when you've got Sheetz and Wawa and Target and others paying some of them $17 an hour, $18 an hour.
They agree too, these folks who don't always see eye to eye, on who they say can do something about it.
It's our elected leaders in the State House, in the State Senate, Governor Tom Wolf.
We hope the government is listening to us and will support us.
Which is not to say they now see eye to eye on everything.
There's got to be accountability. If there's going to be more public dollars moved into the industry, then the industry's got to be willing to be accountable to spending those public dollars on bedside care.
Rather than on things like management salaries, he says. Both the union and management say, look, most nursing home funding comes from Medicaid, whose reimbursement rates, they say, haven't risen in years despite rising costs. Valerie, the union says workers have caseloads of roughly twice as many residents as they should.